Okay, welcome on episode 3 of Pilanami Foundation. I am Fortunate Kambule with you today. Just to recap a bit, last time we spoke about symptoms. So today we are getting into symptoms of TB in children. We're talking kids and TB today. So welcome, Dr. Gugu. You are welcome on our third episode.
Me.
So, Doc, we spoke about TB symptoms last time. Under general, you mentioned that bantu babona ngokuthi they are sweating, they are coughing, they are restless at night, and all of that you have mentioned. So today I want us to get into children. How do we see my symptoms? Are they different from the ones ebantwini labadzala? How does a parent see that my child ngazuthi une TB? What are the symptoms in children?
Okay, that's a very good question, because sometimes we tend to assume that children are little adults. So whatever you'll see in someone who's older is what you'll see in someone who's younger. Remember, Uti, with the previous episodes we spoke about, Uti, the symptoms of TB will depend on where the bacteria has decided to settle. Sakhuluma nango Uti, you inhale the TB, it goes into your lungs, but once from your lungs, if it goes to your bloodstream, then it can affect any organ in your body. So with children can present the same way as umuntu omdala. So especially your older kids, where ingane has got night sweats, your child is coughing, your child has a fever. But more specifically for younger children, you notice that your child is not as playful as normal. They're not gaining weight, ukhathele. So those are usually the first signs of TB in a child who's much younger. And then again, depending on uti le TB figure setlisha wuphi. So let's say if it settles in a joint, then the child can have swelling of the joints, mhlape the knee or the elbow. It will be hot, it will be painful, the child won't be able to walk. If it's settled in the brain, your child can now abe nogligizela, or what we call seizures. They can have, if it's still a very young baby, le fontanelle will start bulging. So just depending on where the TB has settled, those are the things that you need to look for.
So when you say when the child is when it's a little baby, how young do they normally get TB? A month old, 3 months, a year, 6 months? How young they can be infected?
So a child can actually even be born with TB. So if during pregnancy the mom has TB that has either not been diagnosed or has not been treated well enough, they can pass the TB to the baby, and the baby will be born with TB. This is what we call congenital TB. So this child will be born. So it also comes with a lot of complications where the child might be born premature. It's a very small baby. They're very sick and unwell from birth. So TB can affect the baby even before birth and any age. The children that we usually worry about is especially the children under 5, because their immune systems are very weak. But children under 2 years usually progress to having very severe TB very quickly. So you also have to be very careful of all these signs and symptoms of TB in a child who's under 2.
You're speaking about children who are under 2. Let's get into the treatment of TB. Most people who have TB go age to old people. I think we've spoken about it last, or people normally say, TB 2 weeks evening, 2 months evening, you're feeling healthy and strong. People stop taking the treatment because they feel good. The medication is too much, and you still have to go for 6 months. It's 2 months later, I feel good. Meaning, fortunate now I can go on and move on with my life. Treatment. What is the treatment like when it comes to children?
So we've made very great strides when it comes to the treatment of TB in children. Before, we didn't have any medication that was child friendly. So the medication abantu abadala bebekhala ngayo ukuthi it's so big, it doesn't taste nice. It was worse for children because we had to take all of those tablets, let's say we crush them and mix them with water and give it to the child. So you can imagine having to give a child the solution,
the orange,
like then you have to crush it and give it to the baby. So in the last couple of years, there's now what we call pediatric friendly formulations. So this is amapilisa dispersible. So ngati ino ganje, where you put it in water and it melts. So some come with a flavor, so maybe strawberry, etc. And then amanye don't have any taste. So it's made giving children with TB treatment much, much easier because we have these pediatric formulations. Another great stride that we've made for abantu abadala, we know we're giving treatment for 6 months minimum, but since September last year with children, you are actually able to treat certain children for only 4 months instead of 6 months. But obviously it depends on some criteria that we have to look at to see, does this child qualify to get treatment for 4 months, or do we have to then extend their treatment to 6 months?
When we speak about the treatment 6 months, you just said labanye bayithola for 4 months. There's a parent or a grandparent I spoke to. I hope our camera person will be able to play the clip, but she's spoken about the child taking treatment for about 18 months and the child had MDR. And I was asking myself that how does a child has MDR at the age of 3? And now they have to take TB treatment for 18 months. Does this child has had TB before, or maybe this child was born with TB? What normally happens?
Mina nginglusi inkosi akahlalela ukukhwehlela angacetsi wathi une TB iMDR wamthumela eSanta eBarberton isengakavalwa iSanta eSanta bamthumela eWitbank sibedlela bathi ba specialize ngabantu labane TB wayicala ke i-treatment yakhe 2019 uyinathe waze wayicetha after 18 months. After that uphile saka umacala le treatment bekungahlali lutho esiswini. Onke lamalanga ngiye esibhedlela bathi esibhedlela yebo gogo vele lamanye atomhlanjisa wena nje ubeketela umnathise ngithi mfana nami sohlande kakhulu Nkosi yami bathi mnathise gogo angalikhipha uyamnika lelinye umntwana lomncane kangaki le MDR uyithathaphi iMDR kana ayibambi thina lesesigugile yini bathi bodokotela ungathuki gogo sisheshe sayithola.
So for someone to get MDR, or for our viewers at home, what we call drug-resistant TB, which is a TB that doesn't respond to the normal medication that we usually give. So you could find that maybe this child has had TB before that wasn't treated properly, and therefore the child then developed resistance, and that's why now they have MDR. Or remember what we said, TB is spread through the air, and children usually don't give TB to other children. Children will get TB from umuntu omdala. So if when as the grown-up has EMDR and you're breathing out MDR, the child will be infected with the drug-resistant strain of TB. So it could be possible that maybe the child had TB before that wasn't treated well, but it could also be that there was an adult source that had MDR.
Okay, I think when I listened to the clip, she also mentions a issue. It's another medication, I think, that they take. Yeah, it's like the seeds. And then she's saying it helps with the lungs. Can you please explain that kind of treatment? What treatment is that? Are they still getting it even now, the children?
Okay. So like I said, year in and year out, like as we are sitting here, there's ongoing trials, there's ongoing studies, just trying to ensure that we get better and better at treating TB. You mentioned earlier on that this child was on treatment for 18 months. So currently we don't even treat children for 19 months. You can treat a child for 9 to 12 months if they have MDR. But where we are going and where the WHO has guided us to go is we can actually treat children now with MDR for 6 months. And the drug that you're talking about is a drug that we call PACER. So it's one of the TB medications that we use to treat MDR. And unfortunately, one of the most common side effects of Leo medication is vomiting. But because, like I said, every year, every time they're doing trials, they're doing studies, we don't really use that drug anymore. So probably that child had MDR quite a while ago.
Yeah, the child I think now is about 8, 9. And when he had the MDR, he was 3 years old. So it's quite a long time ago. But then now, speaking about vomiting, she also mentioned that every time she'll give the child the medication, he will constantly vomit. And then she was told that as soon as I keep her the pills, no move vomit 5 in that moment. Keep on giving the treatment. How is the treatment that the kids are getting now? And if they vomit, is it still the same procedure? You need to give it again until the treatment is in system. What happens?
Okay. So like any other medication, TB medication also has side effects. And one of the most common side effects, especially for children, is your vomiting. So the most important thing, I wouldn't say, Uti, if you have a child on the TB and you give them the medication, they vomit, just give them again. It's very important to consult your healthcare facility, whether it's your nurse or your doctor, so that they can assess what is the cause of the vomiting, because other things can cause the vomiting while the child is on TB treatment. So first, you need a clinician, an experienced clinician who's first going to assess why is this child vomiting, so that they can manage accordingly.
Okay, doctor, as we're wrapping episode 3 of the podcast today, I just want you to advise a parent who is suspecting and who has learned today that the child might have TB or something that looks like TB, seeing the symptoms now that you've mentioned and outlined them. What can you say to that parent?
Okay. It's a very good question. I would encourage that parent to visit their nearest healthcare facility. So whether you have a child who has these symptoms, or ekaya, there's an adult on a TB and there are children in the household, it's very important to uvakashele your nearest healthcare facility where this child can be assessed for TB. So if kumdana or konukwehlela, then they are able to test, but there are other ways that we can test children for ETB. So that would be my word for the day. If you're suspecting it, if there's someone at home who has it, please take your children to the nearest healthcare facility and they'll be tested free of charge.
Thank you so much, Doctor. That's it today for episode 3. Let's meet again in episode 4 on Pilanami Podcast.